So folks are starting to gather. We're going to give it another minute or so, and then we'll get started. It's good to see people's faces. And so, Susan, Alberto, are you really someplace with a palm tree, or is that just your background?
I wish it was just a background.
Well, it's lovely.
I like the waves. They keep moving.
They do. They keep. It looks real. Well, I have 10:01 on my watch, so we may have some more people jump on the call. We had about 15 people respond. I'm Gina Balkis. I'm the CEO here at the Home Care, Hospice, and Palliative Care Alliance of New Hampshire, and I want to welcome you all today. The purpose of this meeting is to hear more about Rivier University's program to train student nurses, to tell you what would be involved in training student nurses in your home care agencies, and also to hear about Rivier's preceptor training program that's available to help your staff who might serve as preceptors for student nurses. So I'm going to introduce Emily Sheff. She is the partnership liaison at Rivier University, and Emily, welcome.
Thanks so much for having me. I actually put together a really short PowerPoint to kind of just be able to share some things. So I don't know if I have the ability to share my screen. I think so. Yep. So let me share that, and I'd love to talk to you all about Project REEP. Oh, actually, it looks like I just need permission from the host to share.
Well, I think Leslie's giving you that now.
Perfect. Thank you. I'm sorry I didn't send it to you ahead of time.
Are you able to, Leslie? Oh, I'm the host. So, can't hear you, Leslie, you're on mute.
So hover over the top right-hand window of Emily's screen of her picture, and you'll see three dots on the right.
Yes.
And right
yes,
there,
yes.
It'll say allow.
Okay, hold on. I had it for a minute and it. Make co-host?
Yeah.
Okay. All right, Emily, you should be all set now.
I got it. Okay, perfect. Let me share this one. And then hit the presentation button. Okay. So I just wanted to I'll go over, give you a little bit of background, and then just dive right into what kind of we're doing. So this is the NEPQR grant. We have named it the Project REEP grant at Rivier, but that's the official title with HRSA. So the Nurse Education Practice Quality and Retention Grant that we received. It's a 4-year grant. We're entering the 4th year, but we have a great sustainability plan. So something that the school plans to continue on after the grant itself is done. And before I get too far too, I wanted to also introduce Cassie Bragdon is here with us today as well. She is a new part of our team. And so I asked her to join today's call as well so that she can learn about Project REEP again. We've talked about it a little bit, but just to give her the overview in addition. So she is someone that we will be working with as well as part of the grant, and is a great asset to our team. So welcome, Cassie. So first, the purpose of our grant. So basically, in a nutshell, these are our official purpose and intents as part of the grant, but I like to describe it that we've been telling patients for years not to go to the hospital, to be treated in their communities, to be treated, or go to the hospital if you need to, obviously, but to first seek out care in our communities and with our providers. But we weren't doing so great at getting our nursing students out in the communities or out far into the communities and into rural areas. And so what we're seeing is that, students in their senior year are all requesting their practicums to be in acute care hospital settings and to, because that's what they know, that's what they've seen in their clinicals. And so by doing this grant, we're hoping to expose students to a more variety of nursing fields and get the care where the care is needed. And then we've seen an uptick in our students that request home care or rural setting or different community settings for their practicum as a result. So it's been really, really rewarding on our end to be able to see that change, and just to make that awareness that it's not just the hospital setting to go into. There's many different areas, and some students we actually have 2 students that started at community health centers as a result of being exposed to it during their clinicals this past year. In light of COVID and everything else, we still were able to get through, so that was really exciting. But we're looking at recruiting and training our nursing students to practice to their full scope of license in community-based primary care teams. So as we all know, community care, it ranges from anything. We have students that are in prison settings, we have students that are working in home health, we have students in community health centers, we have students that are working out with VNA of Vermont and New Hampshire, or VNH of Vermont and New Hampshire. So they're out in rural Vermont areas. The first day of clinical, our first year of the grant, there was a mudslide and the student couldn't get back to their car at the end of the day. So we had to find a bed and breakfast for the student to stay in that night. And it actually wound up being a wonderful experience. But we're ready. It's a spring semester we do this, so January through April. So we're ready for all sorts of weather. I feel like I'm a meteorologist for those months because I'm monitoring weather in northern Vermont down to Boston area and all throughout in between, which we all know you can be 10 minutes away and have different weather cycles. So making sure the students can get to and from clinical safely as well. So that's pretty much the main overall purpose of what we're doing. The way that we have our and I kind of talked about that a little bit already. But what I also do is we have students, most of our students at Rivier, 92% live within a 60-mile radius of Rivier University. So they are not only in the area for school, but they're staying in the area when they graduate, which really helps with retention and recruitment of nursing students for full-time roles within the community or within their areas as well. So those are the numbers based on last year's class. I haven't run them for this class coming in yet, but we've always hovered around the 87 to 94% with our students being within a 60-mile radius. So what that means is that we're able to really help with student placements, hypothetically, if it's a good scenario and there's a win-win situation, that we are able to help with some recruitment of our students into full-time nursing roles. What I do on my end is if I have students who plan to return to their home area and it matches to be in a rural area where we have a partnership, I try to place students close to where they live already or where they plan to return to, so that helps as well. And at the end of the day, even if it's not going to be something that works in terms of where they're going to continue on with their job, they have that awareness of what's happening in their own backyard, and they have that awareness of where their patients are being treated and seen within their own community. So it's really an incredible piece of it that students have really enjoyed. And I had a student who was living in the Berlin area, and she actually worked in the correctional facility up there, and she was like, I have no idea that this was in my backyard and that all this care was happening right around the corner, and that I had no idea these opportunities existed. And she ended up going into a long-term care facility nearby, but was really excited that she didn't even think that she had the opportunity to be able to work where closer to home. She thought she was going to be commuting a pretty far distance to work in a more hospital-based setting. So we're able to really match the students when possible to be close geographically as well. And these are our individual goals. So first, getting our BSN graduates to have the necessary preparation to care for patients in community-based primary care settings. But we're also looking at working with our nurse preceptors and our nurse faculty to ensure that they have the education and training and continuing support that they need to be able to work with our students and also work in the role. So I mentioned briefly that our course runs spring semester. So this year we're looking at January 21st through April 29th of 2022. I can't believe I was writing 2022 already, but that's our next semester. It's basically a 14-week period, but the students do have a week of spring break, and then the first week we usually do orientation. So it ends up being a 12-week rotation that the students are doing. And we run this clinical in more of a preceptor model, so more of a one-to-one relationship versus having, 8 students in one setting or those kind of things, because we really want them to be able to have that close connection with the nurse preceptor. So ideally, it's one nurse preceptor to every 2 students over a 12 to 14 week semester. What that means, it's usually a one-to-one relationship where the first 6 weeks will be with one student. So nurse would be with one student for 6 weeks on Thursdays and Fridays. And then the second 6 weeks would be a different student with that nurse on Thursdays and Fridays, if that makes sense. So over the course of the semester, one nurse preceptor would have 2 students, but not at the same time. In some locations, a 2-to-1 works out better so that nurses do have 2 students with them, and we're really flexible and willing to work with whatever works within organizations. But that's kind of the model we've created and how we usually work things. But we're of course amendable to every organization that we partner with to what works best for their organization and their students. When possible, we are able to give a stipend to the preceptors. We are able to give $250 for the course of a semester. Sometimes things happen where they can only do half a semester, so 6 weeks with one student, and we're able to cut that in half to $125. The money needs to be directly given to the nurse, and the nurse needs to kind of register with RIV to get that payment. It's not just, we're not able to just kind of dole it out. We need to have everything documented for HRSA, which makes it a little bit more paperwork intensive, but it's something that we can offer depending on the organization. Sometimes there's a organizational limitation on nurses receiving that money, and sometimes not. So it really depends on the organization. It's not something I talk to nurses one-to-one about. I talk to usually who my contact is, so that way if there is a reason they can't receive it, I'm not setting up that expectation there. But we do have those monies available. We also do a Preceptor Fellowship, which we have money for as well to provide. So we have partnered with Southern New Hampshire AHEC, and there is a Preceptor Fellowship modules. It's about 9 different modules, and it probably takes about an hour for each one. So it's about 9 hours in total. It's asynchronous. It's all online, and it's all free for the preceptors to do. It's actually free for anyone to do, but if you want contact hours, if you're not part of this program, then there is a small fee, I think, for processing. But within Project REEP, everything is free, and we actually provide a $250 stipend for the preceptors that complete that as well, in addition to CNEs. It gives education in all areas of preceptors. I know when I first was a preceptor, I was like, sure, but I didn't really know what that meant so much. And I was happy to definitely be a part of that. But we're able to provide programs like giving feedback, setting expectations, how to incorporate the learner into a busy work environment, difficult learning situations, like different things that kind of come up as you go through, but you may not think of at first, or maybe that nurses want a little refresher for, or they've been precepting for 10, 15 years, but have never really had any formal kind of just discussions about these pieces. So we're happy to provide the Preceptor Fellowship program as well. And that's in partnership, as I mentioned, with Southern New Hampshire AHEC. In addition, with Southern New Hampshire AHEC, we offer continuing education, and there's CNEs provided for that as well. There's a plethora of different modules that our nurse preceptors or anyone in the organization truly can take part in. Things on substance abuse, social determinants of health. There's some new ones on COVID-19, chronic diseases, and we talk to our partners every year about what things they want to see next. So, a couple of years ago in Nashua, there was a hepatitis B outbreak. So we talked with our partners, and that was something that came up. So Southern New Hampshire AHEC developed a module on working with hepatitis B patients and how that process rolled out when they had that uptick in the area. So we definitely want to keep it timely and be able to respond to what the needs are of our partners as well. Let me go ahead on this screen. Here's an example of the Preceptor Development or Preceptor Fellowship program. I'm sorry. So this is a flyer that we provide both electronically and physically that we are able to share to get the links. Most of the modules have been converted to be interactive voiceover presentations. There's 1 or 2, I believe, that are still in more of a monograph form and just more of a reading kind of piece. But like I said, they're all asynchronous, so there's no need for preceptors to have to log on a certain time, or, you know, we know that was one of the first things we learned about when working with community nurses, that no one has the same time free or the same day free ever. So making things asynchronous and making things work when is best for the preceptors was definitely key. And every year we just ask that things are done by May 30th, because we have a June 30th deadline for the grant to have all the monies paid out and things like that. So we have a deadline just in terms of stipend wise, but as far as availability, this is always available on Southern New Hampshire AHEC's website. And so that's been a really great program to be part of. And then also as part of the grant, we do 3 different conferences a year. These are the 3 we did last year. Last year was so different in the sense that some of our partners were not able to take students that they normally were due to COVID related pieces, whether it was directly COVID related in terms of having more exposure, or staffing changes and new nurses coming in, and just they weren't able to accommodate students at that time. So we really wanted our students to be able to be exposed to all the different amazing opportunities they had been. So the first conference that we held was Day in the Life, Community and Public Health Nursing, and we partner with 8 of our different organizations, and they basically gave a day in the life summary videos of what goes on in their facility, and the students had opportunity to ask questions. We did a panel discussion that was live, so they were able to view the videos ahead of time and then bring questions, and that was really, really rewarding. And we opened that up to a larger audience. So we actually had some nursing schools all throughout the country. We had a school from California that joined us, and another one from Arizona, and it was really rewarding to kind of share these kind of pieces. And we tried to get as much of a variety as we could to be able to share the many different day in the lives that we could have. So that was our first one. We did a zooming into telehealth. That became a need that everyone kind of telehealth and teleconferences and Zoom, and we all became experts in that. But quickly we realized that we wanted to be able to give some more education about it for our own staff and our own organizations to express a need as well. So we did a conference on this, and then our last one we did resiliency in nursing, and that was a really wonderful 2-hour short conference that we did. They were recorded so that we could share with them after, but for people that weren't able to join us live, but we were able to do some Q&As and panel discussions when they were live as well. So that was what it looked like last year. This year we're already starting to plan, but we only have one. We're looking at doing some work with our public health department at Rivier University to provide a conference on human trafficking this fall, and then we'll have 2 others coming in the spring that will just be dependent upon what we kind of see needs in the community wise. We did one last year during the height of the COVID pandemic on mindfulness and meditation, and everyone just needed that kind of breather for a minute when we were all working so hard and in such different conditions. So we just kind of try to meet the needs of what's happening currently, or where we see that. We've done conferences on substance abuse disorders, and worked with a couple of speakers on transgender communities, and just kind of trying to grab the gamut of what we are able to work with in the communities and how we can share some education and knowledge there. Oops, those came up after. I talked about Day in Life already a little bit, but these are the different organizations we partnered with for that Day in Life series. There were 8 video libraries of 3.5 hours worth of content, and where the students would have been for their longitudinal placement, and it was really, really rewarding to do. We also partner with Amanda Fay. She is, I'm going to not say her role correctly, and actually she's transitioning her role, but she works with VNH of Vermont and New Hampshire, and she did a video for us on preceptors and student colleagues and resiliency and reframing a precepting relationship, and talked a lot about the partnership versus it being a kind of a hierarchical situation, and just really talked a lot about that resiliency in nursing, and how it's such a partnership. So the students felt some kind of ownership to that relationship, and it was a 2-way street, and being able to communicate and how they work best with preceptors and students. And that was really a rewarding piece too, to give reframe that module. Oops. So that in a very short nutshell, I've talked about this for the past 5 years nonstop. So I'm sure I glossed over some areas that need some further discussion or clarification. We do have a QR code that links directly to our Facebook page, and we share some of the information we do there throughout the year as well. But overall, I just wanted to take a time and thank everyone for being here. And I think the discussion of this is something that I would love to have with each of you. And we are, I believe we're at 117 students for this incoming class, and last year we were 87. So not only are we always looking for new partners, but even more so with the uptick of students, which is a wonderful problem to have. But we would love to talk more if this is of interest to anyone. And literally my job and Cassie's job is just to make this seamless and easy as possible, and as rewarding an experience as it can be. So that's the amazing part of this grant, is that they've had provided full-time individuals to work with this to make sure it's running well and up and smoothly processing before we end the grant and continue on. So, but that's literally our role. So we are here for questions and would love to talk more.
Thank you, Emily. If you can go back to gallery view, just stop sharing your screen and we'll go back to gallery view. I know that there are questions from the group, and I think Melissa from Interim has a question.
Thank you. Thank you very much. Hi, Emily. Thank you so much for giving this presentation. I have a couple questions. The first question is, would this be a hands-on component or strictly observation for the students?
So the way that so it can be hands-on. So from a Rivier perspective, we would love it to be as hands-on as possible. However,
Okay.
we've worked with organizations where that's not possible, and observational is the only option we can work with. So it's definitely up to the organization that we're partnering with. With that said, our students, this will be their 4th clinical experience, and in terms of skills lab and whatnot, they've done injections, they've done so they've done assessment skills, and those are all things that they can do, and that's something we can talk about further if you want more exact lists, and
great.
we sign off on kind of thing. Yeah.
May I ask another question? So we have a variety of different arenas, if you will, where we deliver care in the home, such as intermittent, continuous care, and CFI. So we are wondering if that would be, there'd be some great experiences in each venue, if that's something that we could have the students traverse, each of the different venues that we have, which may mean that they have more than one nurse as their preceptor. How is that done?
So we've definitely worked with that as well. So we've had students that work in emergency departments, and so they are not always scheduled with the same person. So what we do in those scenarios, and actually before I go further, can you so you said CFI? I'm not as familiar with that abbreviation.
CF, Choices for Independence, is the Medicaid home and community-based waiver service. So it's generally, at least with the skilled nursing, it's nurses who are going into the homes. It's less acute, more chronic long-term care provision.
Yep. Okay. Thank you. No, perfect. Yeah. Of course, all that aligns right with what we're working on as well. So what we've asked in the past is that, so basically at the end of the day, is that one-to-one relationship is purely to be able to develop the connections, but also to make sure the students is meeting the expectations of the clinical setting. So it's more just we have a evaluation kind of sheet that gets filled out by the preceptor at the end of it. So it would be something that we'd ask that each nurse working with a student look at to make sure, did they meet this today? Did they, what did they do during the day? It's a simple kind of yes or no. And if it's things, not everything's going to be met, but making sure there's no concerns, I guess, would be the key on our end.
Sure.
Go ahead, Melissa.
Oh, I'm sorry. So in that instance, we would have more than one precepting nurse.
Yep.
So I just want to make sure that was okay.
That's completely fine. The other piece,
Okay.
and I'm glad we're talking about this now because I forgot to mention it during it, is that because we are a BSN program, and this has come up a lot in the community, is that the state of New Hampshire requires that BSN students be precepted by BSN nurses primarily. So and we've worked with many different organizations where students have worked with associate degree nurses, and we all know what wonderful care associate degree nurses provide as well. So we didn't want to eliminate that piece. So what we've asked is that there's a I guess, oversight by a BSN prepared nurse, and there's a connection made there. So with some organizations, the only BSN has been the nurse manager in the area. So the nurse manager has checked in with the student at the end of, every other week, or they've, made sure that connection is there, and they've done some work with the student as well. So students have worked with other nurses, just
Okay.
that we have that BSN connection along the line, if that makes sense.
All right. Thank you so much for answering those questions.
Thank you.
I have a quick question. So are there specific competencies that the nurses the students are expected to achieve during this particular clinical rotation?
In terms of skill-based competencies, no, like there certainly isn't like a checkoff for injections or a checkoff for, assessment. Those are things we do in the lab and with our simulation lab here. It's the evaluation, and I can share that as well. I can send that out. But the evaluation is more about, does the student behave professionally? Did they, did they prepare for clinical? Did they, what was asked of them was achieved? Did they understand, when they did an assessment, were there any concern? It's more looking for, we want to make sure there's nothing of concern on the end of the preceptor. But
Yeah,
Other
hi.
questions from the group? Karen, go ahead.
Yeah, this is Karen Watson, Director of Program Development and Staff Competency at Home Health Foundation. So we actually have several offices. Some are small, some are larger. So our main office is in Lawrence, Mass. But we also have an office in Malden, Mass, Lowell, Newburyport, Bedford, and Northampton. So we actually just started this year a nurse residency program, which we are probably going to be increasing that. So we're very interested
yeah,
in
definitely.
participating. So yeah, I know that you said it depends on where they live and it's 60 miles. I don't know if those offices are kind of in the area that they live or.
So one of the great parts of the grant is that they do provide us to allow for accommodations to the students. So if they travel more than 60 miles from Rivier, then we are able to pay for them to be in a hotel along with their mileage and food for the night. So the clinicals are Thursdays and Fridays. So the students would do 2 days back to back, and they would come up on, either usually Thursday morning, we ask them to drive there, and then we'll pay for the overnight Thursday night into Friday. But if there's a storm coming in, we've sent students up on Wednesday because they want to beat the weather and all different kind of scenarios.
So the other question I have is about COVID. So we put all of our students on hold this past year because of COVID and being in the home. So right now, it would be a requirement that they would need to be fully vaccinated, and I don't know if that's an issue.
Yep, no, that's actually a requirement in Rivier. All of our student, faculty, and staff are fully vaccinated as of August 1st.
Okay.
Yep. So yeah, great question. Thank you for asking. So.
Other questions?
So you said that it's 14 weeks, but it's 2 days a week for that 14 weeks. Is that right?
Exactly. Yeah.
Okay.
And it ends up being actually only 12 weeks because the first week's orientation on our side, and then they have a week spring break during there. So it ends up being 12 weeks.
Okay.
What happens if there's a snowstorm and say they can't go out Friday? Do they need to make up that day?
So we've had a number of different scenarios. So if it's possible to make up the day, we've worked with that. If that's because some students, they're in class all day, Mondays and Wednesdays, but some students have some flexibility on Tuesdays. So there's been times where that's worked out. But when we went through the COVID pandemic, we all flipped on a dime and made everything virtual. So we've kept some of those modules, and we do have the ability to provide a virtual full day experience with an immersive simulation. And they've gone. Last year we had many students going to COVID vaccination sites for the day with one of our nursing faculty at RIV to make up their time and things like that. So it's all about flexibility.
Now, do they have to do a project at the end, like a community like present something, or I'm just curious.
So as part of the course, they do a windshield survey. So they do that separately. That can be, we tell them it can be their clinical community, it can be their home community, it can be Rivier's community, whatever community they choose. So some students have done it with their clinical setting. Some organizations have had the students do a project or work on something throughout their time there. So that's been part of it. And then the students meet weekly with their preceptors and their groups. And when I make their clinical groups, not preceptor, I should say, the Rivier faculty. So Rivier faculty, and they all have I try to make their groups as diverse as possible in terms of their clinical placements, so they're hearing each other's experiences and they debrief kind of through that way as well. But yeah, it's been in such flux because of COVID that we had like a year, 2 years that were not normal, but we were working towards doing something as a project as well. When they're seniors, these students are all junior year BSN. When they're seniors, they do take a research course, and many of them choose their research project based on the clinical experiences. And I teach their research course, and I see community health keep popping up in that way too. And I encourage them, like, reach out, share with your preceptor what you've learned.
Sometimes what we've done with students, sometimes they might have a great opportunity to go out with a wound nurse or attend a team meeting to, do we do IDT and to see what that's like. So sometimes we incorporate, other things that they might be involved with. So I think
Yeah,
that's
definitely.
okay.
Emily, can I
all
ask a
those are
question
true.
that's like a follow-up on what Karen just said?
Yeah.
Is that if we do have the opportunity for the student to go out to see an interesting case, would the nurse that he or she go out with that day have to have completed all of the preceptor training?
No, so good question. No one, that is not requirement at all. That is purely, something we offer, and certainly for the stipend, it's something that can be a great experience for both the knowledge and being able to provide extra funding. But that's not a requirement for any preceptor.
Okay, thank you.
But I have to say, one of the complaints that I've heard from agencies when we've talked over the years about taking on students is the lack of preceptors. And so I think the preceptor training that you're offering is wonderful. And really, the fact that there's a small stipend involved is great as well. I mean, I think you want to have preceptors who are confident working with students and understand different learning styles and understand difficult conversations. And then, so Emily, I just wondered if you can talk a little bit. I know that you've mentioned that you've done, you've had students go to home health and hospice care in VNA of Vermont, New Hampshire. Can you share, are there any particular issues or challenges or successes that have come up in home care settings for students?
Yeah, so happy to. So there has been a number of wonderful stories to share where students were able to connect with families and patients in ways that they didn't anticipate. Students are always really nervous to go into a one-on-one setting with a preceptor because they've all used to being in larger group settings. And additionally, they're all nervous to go into someone's home because it's we start out the clinical semester with talking a lot about what that means, because we realized the first year that the students are used to a more formal care setting where, whether it be a nursing home or hospital, where they're entering the patient's room and the patients are a guest at the hospital, and now they're a guest in the patient's home in a lot of times. And that completely kind of flips the script in how, a lot of things are done, and having respect and awareness of that being in their community or in their environment. So that's something we talk a lot about in their before they get to clinical. We have a partner that we've worked with for the past couple of years at Boston Home Health Aides. RJ Lawson he's a graduate of Rivier, and he absolutely loves to speak to our students. And so he comes in and talks to them about what that means to go into the home. And he shares a great story with them about how, he knew a patient liked orange juice. So he would always make sure to buy orange juice before he went in. And it was, as much as it was a gift and a nice gesture, he also wanted the opportunity to open their fridge and make sure they had food for the week. And so this, by buying the orange juice, let him say, I'm going to put it in the fridge for you, and let him get a quick inventory that patient had enough food for the week. And the students all have, every year, they all have that complete aha moment on their face, like, oh my gosh, that's a great idea, or I didn't realize we'd have to think about that, or just have those moments of awareness and recognition. So it's really, really rewarding to be able to talk to them ahead of time and to be able to get them prepared for that. So that's been a rewarding piece. In terms of challenges that we've had over the years, weather always plays a challenge at the time of year it is. Communication, I think, is always a challenge, because the students are all in different sites and they're working with multiple preceptors, that ensuring that everyone knows where they're supposed to be, and making sure that a lot of those pieces all fall into place. And sometimes a nurse preceptor will be all ready for a student and then have, a sick child and so the student's with another person last minute, and the preceptor looks at the student and says, what do we do today? And the student's like, I don't know, you tell me. And then, so we try to make sure that everyone always has contact information they have a couple different levels of communication. The students all have nursing faculty at Rivier. They have a clinical faculty they're assigned to, that's small groups. They have my cell phone, they have Cassie back at the office, and they also have Dr. O'Hara there as well, the program director. So they all have our contact information. We always tell them, communication is key, but I think that's always been a challenge in such a diverse clinical experience where they're all throughout the different states and things like that. Trying to think of some other challenges. I think, one of the challenges, to be honest, is with the payment process, in terms of we can't just give a check to each preceptor. They have to go through the payment process at RIV, which means they just need to fill out a W-9, and that can be a barrier with how busy everyone is for the preceptors, and that's something that we just can't get around because it's a HRSA payment. So that's unfortunately, and every year we try to start the process earlier and earlier in hopes that we're able to help alleviate that barrier as much as possible, but it always becomes something that's more burdensome, and that's hard for us on our end because we want to be able to provide and make it seamless.
Other questions from the group? So Emily, do you place the students with the agency, or does the agency have an opportunity to interview the student first, or how does that placement process work?
So typically with our undergrad students, this is not an interviewed position in terms of our students are all prepared and ready. But I typically will place, and what I do is I have the students fill out a questionnaire for me in about October, and I ask them to kind of rank their top 5 list of placements that they are interested in learning more about, and with the disclaimer that, not everyone will get their first choice and not everyone gets second, but that so that way I know if someone's really interested in working out in the home care community, that I can place them there. Or if someone really wants to know more about public health nursing, that I can, hopefully make that opportunity possible. So I do ask them to complete that, and hopefully most of the time we're able to align. And I also ask them if they're willing to travel, and, with the understanding that we would provide lodging and meals, because I know some students can't with family obligations and work obligations and things like that. So we make those things communicate as clearly as we can up front, and then we make our placements. And like I mentioned, we try to do geographically where the students are already living and or working, so that we're able to provide that long-term connection if it's a win-win.
Can you talk a little bit about the timeline at this point? So if any of these agencies who are on this meeting want to take students, what is the process and the timeline for getting that set up?
Yep. So actually, this is perfect timing. Every July, I reach out to our academic partners and our clinical partners and ensure that they're able to take students again. So this is when I start talking with our agencies right now. So, and of course, everything can change, but we talk about what worked last year. What, can we had 2 students last year. Can we have another 2 students this year? How about, it's possible to have another preceptor, and just kind of get some rough numbers, with the understanding that nothing you're saying today is set in stone, and certainly not set in stone if you think there's more room for more preceptors. But we start talking now. If it's something that's of interest and we do not already have a partnership signed, then I work with our nursing department to get an MOU signed in terms of the agreement between the organization and Rivier. Many times we have master's degree students or NP students that are with organizations, so there is something already standing, but if not, we've done that multiple times. It probably takes a month or 2 depending on vacations and who's around for signing. But now is the time we start talking, and we talk roughly about just how many preceptors do you think, and then what reorientation requirements would be needed. The students are in clinic or are in class until mid-December, so as much as I can have prepared before they leave, the better. So oftentimes organizations will require a separate background check. Even students are all background checked and we have all that to provide, but sometimes they request a separate one, or sometimes they request that certain orientation be done. And so they we're able to kind of talk about those things ahead of time. Once the students leave mid-December, I don't have them back till mid-January when the semester starts again. And certainly we can get them up and running, but it's a lot easier to be able to coordinate and schedule if I can tell them, you know, you're going to be placed here and they're requesting an orientation and they'd like to do it January 3rd. Are you in the area? And, you know, if we can kind of make those connections happen. But they are also have the ability to do everything online as well, within organizations that traditionally has been worked well. So long story short, we start talking now and nothing we say is set in stone, but we kind of keep going throughout and we just keep doing check-ins throughout the time and hopefully have everything aligned by, you know, usually by mid-November, because once the holidays start, we all know how things get moving fast and then, yeah.
Would it be acceptable for the experiences to either be in home care or hospice?
Yep. We've had organizations we worked with where students have only done one. We've had students where the students do 3 weeks. If they're there for one student's there for 6 weeks, they do 3 weeks with home care, 3 weeks with hospice, and the students flip. Either one is completely fine. I think that, you know, just both have their benefits and both have, you know, having that one-to-one connection for 6 weeks versus 2 different experiences is, you know, a win-win either way. So whatever is best for organization. We really, I mean, that's solely my job, is to make whatever opportunities we can get work for you as the organization. So we are very flexible and very amendable to whatever we can make happen.
Other logistical questions from the group?
Yeah, I'm thinking, because we hadn't had to think about infection control, you know, just a general, they'd learn when they went out with the preceptor. But yeah, I'd probably have them do something maybe for an hour online to watch about what infection control is like with the pandemic versus in a facility is very different.
Mm-hmm.
And so I think that's one way to get around that, so they don't waste time, like that they actually go out and see patients. Because that's the one challenge you didn't have before.
Yep.
Because right now, we just started only last month that our regular preceptors and new staff are finally able to travel in the car together.
Oh, wow. Yes, that was something we thought about right away. We're like, oh, wait, that doesn't seem like a great idea. But then, yeah, so yeah, yep.
With the ability to obtain PPE, one of the requirements we've had recently was for the schools to provide PPE for the students. Is that something the university is able to do?
Yep, we did it last year. So we just
Okay.
ask ahead of time what you need, and our lab coordinator kind of made up packets depending on the site and was like, okay, here you go. Here's your stuff for the, you know, so
Great.
Different sites have different requirements. So yeah.
Okay.
Yep. And things like that, that's really why we start talking now, because I mean, and things may change, but you know, if we have those lists by October, November, and we're able to kind of order ahead, so we're not scrambling last minute, it just makes it more seamless. But like I said, things have been changing by the hour, some weeks with COVID related, especially. So
Yeah.
Hopefully, knock on wood.
No, it sounds very exciting.
Yeah, it's really been incredibly rewarding, because we know the needs there, and it's been so incredible to get the students out where they need to be with patients and to have that education. Because I know when I did nursing school, it was not as intensive of a community health experience, and it was great. But I look at this, I'm like, oh my gosh, they're getting such an incredible opportunity just to be exposed to the environment.
No, so when I did my community, it was in downtown Lynn, and they actually had us do visits alone.
Oh my goodness.
In our nursing uniforms with our little caps. I'm like, oh, thank God they don't do that anymore.
No, we don't recommend that. We actually, and that's a good point too. We do a preceptor handbook almost. It's only there to be guidance. So the hard part is we want to provide the information, but we also know we don't make it a burden to the preceptor. But sometimes, the preceptors will go, well, what am I really responsible for? Or are there competencies to check off and things like that? So we give a preceptor handbook that basically says, like, here's what the student's responsible for. Here's what Rivier's faculty is responsible for. And here's what we're asking of you as the preceptor. So that way it kind of defines the roles. And it's only meant to be in a positive way, not in a prescriptive way at all. It's just meant to help give that information. So everything that we give, we say, like, this is here to help you. If this help you, then please review. But so
I do have a logistic question. Are they able to do a Zoom meeting? Like, they wouldn't have a computer with them. Are they able to do it on a phone if it's needed? Or
yep, definitely. They all have their phones. Yeah, we can do that.
Susan, do you have any questions? Or
I really don't. This sounds fabulous, actually.
Wonderful. I love hearing that.
Very exciting.
It is. It's been incredible, and we would love to. The more areas we can get our students in, it's the better just experience for them and better awareness. So, yeah.
So I go back to a comment that Dr. Paula Williams, the Dean of Rivier's Nursing and Health Professionals Department, said at a member meeting that we had recently, is that nurses are comfortable working in settings where they've trained. And if we're not training nurses in home health or hospice, then we're at a real disadvantage when trying to recruit them after they graduate. And I know we've had there, I met with Johanna Belovo, the CEO up at VNH, and they have, I think, 5 or 6 new grads starting with them this summer, and all of them did clinical preceptorships at their agency from a variety of schools. I think that just speaks volumes about how important it is for agencies to play their part in training students. And so I hope that all of you will reach out. Emily, your email is simply eSheff, SHEFF, @riviere.edu, right? And so anybody can follow up with you directly if they would like to continue the conversation and start working on a program to accept nurses, to accept students, right?
Yep. Yes, please do. I'm always here and checking email. I'll be at the lake the next 2 weeks with my computer, checking email still and working on all these projects. So.
Oh no, you're supposed to take vacation.
I will a little bit, but just having a different view is all I need for a little.
Okay.
well, and I just want to make a comment about what you just said. So when I got graduated from Salem State, 4 days later, I started in the ICU. I was one of those nurses. Oh, I want to do ICU, and was there for 11 years until the hospital closed. And then I said, what do I want to do? And I said, you know what? I loved my home care experience in college. Maybe I'll try that. And I've been in home care for 31 years. So I do think what you said is so important, that they get exposed to it, because you never know where the career will land.
Yep. And I always think, it's just, I have students that, still go into hospital settings, but just having that awareness of where their patients go after they leave, so they aren't discharging and saying, oh yeah, someone's going to follow up. They know that, like, okay, yeah, someone will come in, do an intake, or just they understand the process that much better. It helps just along the entire care continuum. But we've seen we went from the first year I did this, we had 1 student out of 63 request a community-based clinical for their senior practicum. Now, this past year, we had 10 students out of 87 request a community-based care. And just that alone, we're like, just the awareness to, like, there's different areas. And for some students, they're like, we can't wait to do more. And, they wouldn't have had that opportunity or that knowledge or exposure to it. So, and we've had a couple students that entered into a community health facility right out of graduation, and the ones we know of, we don't have everyone's tracking. They're still coming in, everyone's still taking the NCLEX, but we track those pieces, so we're able to see that increase, and that's been really helpful. It's exciting. It's really cool to see what we know has been needing to happen for years, and to get more nurses out there to help the nurses that are already out there doing all the work, and a lot.
Okay, great. Anything else? Well, Thank you all for being on the call today. This is really helpful. We have recorded this meeting, so if you need to share this with this information with somebody within your organization, just reach out to Leslie Hammond and we'll send you a link to the recording. Emily, feel free to be in touch with me, and all of you, please, if this is something that interests you, reach out to Emily directly. Rivier is an affiliate member of our Alliance and a really great partner, so we're excited to be able to work together.
Thank you for having me today. And if anyone wants to talk more or me to talk through this again with anyone that couldn't be here, please reach out. So I'm happy to do whatever is needed, but thank you.
Thank you.
Have a great day, everyone.